Welcome back. Well, do you see COVID becoming one of the many viral respiratory diseases that healthcare providers and patients will manage each year? What is the future of therapeutics and vaccination? Former FDA Associate Commissioner and President, Center for Medicine and the Public Interest, Professor Peter Pitt, joins us now on the program. Thank you for joining us.
Oh, my pleasure. Thank you for having me on.
I'd like to begin by using a term that you are familiar with, and that is coincidence or crisis. Was COVID-19 a coincidence or a crisis in terms of its origin?
Well, I don't believe in coincidences. Whether it was a man-made virus or it occurred naturally in the markets of China, as other viruses have, we need to recognize from a scientific perspective, from an epidemiological perspective, how to make sure that future viruses don't have the same breeding grounds. It's time to act on this as a international community, stop blaming people for what happened and looking forwards to a solution. There's a very important Japanese proverb that says, don't fix the blame, fix the problem. And I think that's exactly where we are relative to learning where COVID-19 came from, so we can make sure that future viruses don't have that same opportunity.
The US is also, one of the global leaders in science and medicine, but it also stumbled badly in its response to the pandemic. Is this something that resonates with you? And what would you say was the key thing that was responsible?
Well, I think the lesson learned here is that we were, as a global community, completely unprepared to deal with any type of pandemic. We didn't recognize the need to reach out across borders immediately, to share science broadly and with immediacy, and to make sure that every country on earth has the tools that it needs, because we live in a global community. What affects China on Monday is going to affect the United States on Wednesday, and Europe and Africa, and so on and so forth. So I think one of the lessons learned is we need to be prepared together. We need international responses together. This isn't, strictly speaking, something that any nation can deal with on its own on an ongoing basis.
And sadly, that hasn't happened. The tools, therapeutics, the drugs, vaccination, and also for, Africa is one example. But what's your take on how you think the continent of Africa has weathered the virus compared to other regions of the world?
Well, I think every region of the world has done poorly. Unfortunately, Africa suffers from a lack of resources, from a lack of manufacturing capabilities, and really relies on other countries, whether they're Western countries or China and India, for their supply of vaccines and therapeutics and diagnostics. Testing is also key, and I think Africa has really fallen behind, certainly the West, in its ability to test. And testing is obviously a key component of managing issues like COVID-19. I think as we go forward, one of the lessons learned is that Africa needs to rely not just on the WHO and on the good intentions of other nations, but as a continent equal with every other continent, with countries equal as every other country, and make sure that its requirements are as important to the rest of the world as the United States and Europe.
Professor Pitt, let's come to COVID-19 drugs. Are there any that works?
Well, I think that obviously therapeutics were slightly ahead of vaccines. The drugs that allow people to have COVID-19 and yet not suffer serious manifestations and be hospitalized and die have been extremely successful. From the Gilead drug remdesivir to products from GSK and from Pfizer and other places, therapeutics have played an incredibly important role in making COVID-19 a non-deadly pandemic. Clearly, vaccines, are the way to go relative to protecting an entire population, and we have to make sure that all of our populations get as completely vaccinated as possible. And we need to recognize that it's not a one and done proposition, not in the West, not in Africa, not in Asia. We're going to probably need annual COVID booster shots, just as we have in the US annual booster shots for the flu. We're gonna have to recognize that, if one person's protected with a vaccine, we all become better protected. And as a fallback measure, we have therapeutics that can help people that do contract COVID-19 to successfully get through the course of the disease and move on with their lives.
I know that the FDA approved the antiparasitic drug ivermectin to treat several tropical diseases, but what role does it play in preventing and sort of treating COVID-19?
One of the important caveats about science is that the plural of anecdote is not data. There is no real reliable data set that shows that ivermectin really is effective against COVID-19. I think that, looking to a inexpensive generic drug to solve the world's problems when there's no evidence is putting hope over science, and that's not practical. We've got to follow the science. Ivermectin is not one of the drugs that really can help us. Similarly, with hydroxychloroquine, the data sets are very thin. The only serious data we have are for vaccines and for the therapeutics that were developed specifically to combat COVID-19. So, crossing our fingers and hoping that a cheap and effective existing generic drug is going to set us free from COVID-19, unfortunately, I think is a naive proposition.
Is that the same way you would feel on about hydroxychloroquine?
I think so. I mean, initially there was some hope that hydroxychloroquine might be a partial solution, but again, a lot of science has been done on hydroxychloroquine, and the data says that it really is not a solution. I wish that were not true. I wish that we had a inexpensive, readily available product to combat COVID-19. Hydroxychloroquine, unfortunately, does not suit that bill, and there's a lot of data to support the fact that hydroxychloroquine is, in fact, not a solution. So we've got to recognize that we have to follow science, even when it tells us things that we don't want to hear.
But I'm sure there is also data that a lot of people, a lot of hospitals mixed and matched, drugs, just so that people can get well, over the months of COVID-19. But also, since the COVID vaccines became available, we've been told vaccines, booster shots, the best preventive measures against severe illness, hospitalizations, and death. Yet, not everyone believes that. How do you convince people of the science when vaccine hesitancy is also very rife?
Well, that's an amazing question. Thanks for that. What we've discovered in the West and certainly in Asia, in fact, I was just in Dubai last week having this exact same conversation with Arab states, is that we have an abysmal state globally of health literacy. The populations of the US, in Nigeria, in the Middle East, in Europe, everywhere, really don't understand what the science says. And if you don't understand what the science says, you can't follow the science, and you're likely to want to believe more simplistic solutions that give you easy answers to complex questions. So I think moving forward, one of the ways that we address COVID-19 and avoid future pandemics is to really ramp up health education in all of our countries. And it can't be one size fits all. We have to look at health education from a national level, from a state level, from a municipal and tribal level. We've got to be extremely granular in the way we get these messages across. We want people to understand them and internalize them and act on them. And I think that there's great possibilities if we understand that the better educated our public is, the more likely they are to do the right thing relative to COVID-19, be it wearing masks or getting vaccinated.
Do you think that there is every reason to expect another pandemic?
Oh, I think it would be naive to think this is the first and last pandemic of our lifetime. And, Bill Gates said the other day that he thinks the next pandemic will be in 3 to 5 years. I don't know how he knows that. I haven't had a chance to look inside his crystal ball. But from a straight scientific epidemiological perspective, let's face it, the next pandemic is just around the corner. We live in a very small world. Airplanes are flying all the time. People are moving around the world regularly at great speed. We have to be prepared, and we need to recognize that need for preparedness begins right now.
Professor Peter Pitt, thank you. Visiting professor at the University of Paris School of Medicine. Thank you so much for joining us on the program.
My pleasure. Thank you, and good luck.